I used to think I wanted to be a dentist, but what I really wanted was to be more like my mom. At an early age, she was determined to be a dentist. The fact that many patients didn't receive quality healthcare services motivated her to be the provider who would achieve that. When we moved to the US, she continued her work as a patient advocate to ensure people received the treatment they needed. As an immigrant student, paying for college out of pocket was stressful for me. Realizing I had limited access to financial aid was even more stressful. When I met others in the same situation, I knew we could do something about it. We found out about the California Dream Act that could provide immigrant students with financial aid and partnered with others to see this become law. And it did in 2011. Today, I advocate for workers who work 2+ jobs to provide for their family because minimum wage is not living wage. Or for garment workers working in rooms with no ventilation in 120-degree weather with no breaks because they have to finish a quota or they won't get paid. I'm currently working on a campaign to implement a statewide workplace violence regulation. In a recent meeting with healthcare workers, we were reviewing Cal OSHA's draft standard. I asked one healthcare worker if the definition of workplace violence was effective. She was frustrated, like everyone in the room. No, she said. It only focuses on physical force. She shared a story about a time when her coworkers bullied her, locking her in the closet for 20 hours. She reported it, but nothing happened. Violence can be emotional, mental abuse too, she said. I didn't know what to say. But after hearing stories like hers, I spent the rest of my summer writing recommendations and presenting them to Cal OSHA whenever I could. In advocacy and policy making, I try to listen. Like my mom with her patients, I listen to workers and see how I could be their megaphone, amplifying their voices as they speak their truth to power.